At Prestonsburg Healthcare, we have a combined total of about 25 years of experience between our therapists providing care to long-term care residents. We offer physical therapy, speech therapy, and occupational therapy. And physical therapy mainly works on ambulation, gait, and transfers, whereas occupational therapy works on functional ADLs, bathing, grooming, being able to feed oneself, and speech therapy works on cognitive language skills and also feeding disorders, where we also have a contract with a company called BEST, and they are able to come into our facility and do swallow studies on our residents to keep us from having to send our residents out to local hospitals and cause them, extra trauma or confusion of being sent out of our facility. Once the therapists complete their evaluations, it's determined how many days a week and for how long the residents are going to be seen, depending on their diagnosis. Generally, people are seen 5 days a week and anywhere from 4 to 8, possibly even 12 weeks of service. The sessions are determined, again, based on the resident's diagnosis as to how much therapy they get a day. Residents get anywhere from 2 to 3 hours of therapy a day, typically, between all 3 disciplines. We realize when someone's admitted to a nursing home that they have a fear that they may never return home again, and we have tracked over the past several years, and we have an average of about 50% of our patients returning home to be with their families. We also have an ADL kitchen that the OT department utilizes for more of our homemaking skills, to be able to practice to prepare meals for oneself, basic housekeeping such as washing dishes, putting those away, cleaning, setting tables, those type of activities. Most of the other nursing homes in our area have contract therapists, and we're special here at Prestonsburg and lucky to have in-house therapists. Our therapists have been with our company 5+ years and are really committed to the revolution. They like spending that one-on-one time with the residents, building the bonds, building the trust, and being able to relate better to the resident and their family and what their needs are going to be, able to make them be able to go home. Without the in-house therapy, when you have contract therapists coming in every day, you don't have the continuity of care. You don't know what they've been working on. You can't decide what their likes and dislikes are. So there's not as good as carryover as there are to the in-house therapists that are there every day and take care of the residents' basic needs every day. A few years ago, we developed and submitted a program that was called City Strollers, which is very unique to our facility. Since we're located in downtown Prestonsburg, we are situated near several grocery stores, restaurants, a post office, our local newspaper, those sort of things, and we like to take our residents out, usually on a weekly basis at least, during good weather. We let them get outside and smell the fresh air, see the flowers blooming, that sort of thing. That does a lot of good for just their mindset. But we work with our quality of life program. We get nurses, nurse aides. We try to make it a facility event when we do take residents out to make it worth their while. Usually we're gone for about an hour or so when we take them out, so it just allows them to get outside of the walls of the building. In our therapy department, we have several different treatment areas, but we do have access to our outside patio, which we try to take our residents out during good weather and let them at least, get outside during that time as well. Our company, Signature, has a program in therapy that it's a competition through all like the rehab, and it's called 100 Days of Summer, and each therapy department has to create an interdisciplinary program to submit. And for the past 2 years, Prestonsburg Healthcare has won second place out of the state of Kentucky with our In Touch program, which is a sensory program developed through our OT department to help facilitate some of our lower level functioning residents, to help them be able to better be more productive in the facility and to be able to meet their needs. We also have another program from last year that's called In Control, and it targets urinary incontinence that is sometimes experienced in the nursing home. And both of those programs also work with dietary, we work with nursing, quality of life, all those different areas to develop an individualized plan of care for each of those residents, so it is all resident specific.